Did you know that human fertility is declining worldwide? One of the reasons is that in the last 60 years or so, more than 50% of children born to women is because of the woman's choice or the couple's choice. There are many studies that have shown that the significant cause of this progressive decline in the fertility could also be probably because of the increasing load of environmental toxins for both men and women. This is a fact that we all want to take care of our Mother Earth, because the Mother Earth gives us everything that we need. But the environment around us is definitely impacting fertility, not only for this generation but also for multiple generations to come. I know that this topic of environment and fertility is indeed a worrying topic, not only at an individual level but also at a holistic level, at a humanity level. I don't want to scare you, but I just want to make you aware of what are the controllable factors and what are the recommendations. If you want to know more, then this video is for you. Allow me to dive deep into this topic of environment and fertility. Hello everyone, myself Dr. Indu from Samruddh Fertility and Urology Center. Today I'll be talking on 3 different types of environmental toxins. What are they? Number 1 is declining air quality or air pollution. Number 2 is the presence of endocrine disrupting chemicals that are found in our environment. Number 3 is the presence of heavy metals in soil and water. Let's come to air pollution. Air pollution has long considered to be a public health threat which affects not only the heart, lung, endocrine disorders, but it also has an impact on the reproductive health. So now the air quality means when the level of particulate matter or carbon dioxide, carbon monoxide, nitrogen dioxide and so on, when the levels are high, these high levels of impurities bring in oxidative damage to the cell. It causes inflammation and brings in endocrine disruption. It also is responsible for epigenetic modifications. What are epigenetic modifications? It is how the environmental factors affect the way the genes work, affect the way the genes express without change in their genetic makeup. There are many studies that show that poor air quality leads to decreased ovarian reserve, compromised egg quality and embryo quality, and thereby affecting one's fertility. It is also linked with irregular menstrual cycles. It is linked with polycystic ovarian disease. A recent systematic review on preconception exposure to air pollutants has shown decreased fertility amongst women who are living in close proximity to highways, and also those who are exposed to high level of nitrogen dioxide showed a decreased live birth. So what are the recommendations? Although it is very hard to control the living conditions, it is advised, number 1, to stay away from outdoor activities when the air quality is poor. Number 2, to avoid areas with heavy traffic or avoid traveling in rush hours. Number 3 is use of HEPA filters inside the home to reduce the chemicals in the air. Coming to the second type of environmental toxin, that is endocrine disrupting chemicals. These are also called as EDCs. These EDCs are present in the environment, in the food, in the personal care products and also the manufactured products. They basically interfere with our body's endocrine system. The EDCs can also get absorbed from the skin or from mother to fetus through the placenta or from mother to child during lactation. How does this EDC act? They act by mimicking or tricking the hormones, thinking that they are the hormones, or they block the natural hormones from doing their job. So these EDCs bring lot of disruption in different hormones of the body, and thereby they bring numerous health issues including fertility in men and women. There are 5 different types of EDCs that are common. What are they? Number 1, BPA, that is bisphenol A. Number 2 is phthalates. Number 3, dioxin. Number 4, pesticides. And number 5 is polybrominated diethyl ether. In short, it is also called as PBDE. Coming to BPA, BPA is used in plastics. It is also found in canned food products, toys, pacifiers, cell phones, computers, reusable food or liquid containers. They can be absorbed from air, through food or skin contact. If the BPA levels are in higher concentration, they are known to affect the egg quality, the embryo quality and also the conception and placentation. What are the recommendations? The recommendations are to limit the use of plastic or stop to use the plastic, change to steel containers or glass containers. If a woman is trying for pregnancy or she is pregnant or she is lactating, then she should avoid using packed food, canned food and bottled water. Dioxin is the second type of EDC, and they are basically the byproducts of many manufacturing units. They are let out into water, and that's how water gets contaminated. Today people are exposed to the dioxin into their system primarily through food, especially the animal products or the dairy products. Dioxin gets absorbed and stored in the fat, and therefore it is found in the food chain. According to WHO, 90% of the human exposure is through food, that is through meat or dairy products. So the recommendations are that one should avoid eating fat of the meat or the fish, and one should consider purchasing the organic produce of these non-vegetarian items. Coming to the third type of EDC, that is phthalates. Phthalates are used in plastics basically to enhance the flexibility and toughness. Phthalates are synthetically derived and they are used for various personal care products, medical care products and consumer care products. It is also found in food, and one of the studies has said that the urinary level of phthalates has been higher in those people who consume outside food compared to those who consume homemade food. The recommendations are one should replace the plastic bottles, instead use stainless steel or glass bottles. Number 2, avoid reheating in plastic containers. Number 3, one should try to use fragrance-free products, be it personal care products or laundry products. Number 4, avoid outside food, processed food or canned food, and one should be encouraged to cook at home or eat homemade food. The fourth type of EDC is polybrominated diethyl ether or PBDE. PBDE is used in flame retardants on upholstered furnitures, carpets, curtains and some electronic goods. When it comes to recommendation, people who are working in such a field, they are at high risk. It's a kind of occupational hazard. Number 2, women or men who are contemplating pregnancy should avoid purchase of any new furnitures, carpets or electronic goods. Number 3, one should have the habit, a very good habit of leaving the footwear outside and washing their hands when they come into the house to avoid bringing in any kind of contaminated PBDE into the house. The fifth type of endocrine disrupting chemicals is pesticides. As we all know, pesticides are used a lot for pest control and in agriculture. You will be surprised to know that these chemicals can persist in the environment for years, they slowly degrade and they contaminate our food, water, air, soil. Higher the level of pesticides in the body, the higher the negative impact on the fertility. Now, what are the recommendations? Definitely people who are working in such an environment, they are at high risk. This is a kind of occupational hazard. So people should buy more of organic produce of fruits and vegetables, use less of pesticides. Then if one has to remove pesticides from the fruits and vegetables, then one can use salt water, high salt water or high alkaline water. Coming to the third type of environmental toxin, that is heavy metals. Heavy metals are naturally found in the nature and generally they are not harmful. However, if the exposure to such heavy metals such as mercury, lead or cadmium is high, then it can be associated with fertility issues or reproductive health challenges. Mercury is a byproduct of coal burning, waste incineration or industrial processes. These are let into the water bodies and they get accumulated as methyl mercury in fishes, especially the large predatory fish. Eating fish with high level of mercury is the primary route of exposure for humans. Coming to the recommendations, according to the environmental protection agencies, they recommend that any woman who is trying to conceive or who is pregnant or for children, the recommendation is that one should consume fishes that are low in mercury level, especially once or twice a week. Couples who are attempting pregnancy should check with the local authorities about the water quality and from where the fishes are procured. Pregnant and breastfeeding women should avoid king mackerel, shark, swordfish, marlin, tilefish and tuna. And according to the Environmental Protection Agency, it recommends seafood and fish low in mercury such as shrimp, salmon, pollock and catfish. Lead was used in gas, paints and water pipes. People living in older homes were considered to be at high risk of lead poisoning, especially those in the settings of remodeling and renovation. Other high-risk population includes battery factory workers, jewelry making, and women who use lead glazed pottery for cooking. Other non-occupational exposure includes lead toys, jewelries, use of traditional remedies, and use of imported cosmetics. So coming to the recommendations about how to avoid lead toxicity or lead poisoning, one should know from history if the couples are living in the old houses, especially if they are built before 1978, if there is a renovation work happening. One should avoid use of imported skin products, skin creams. One should avoid use of lead glazed pottery for cooking. If there is any suspicion of lead toxicity, then such patients should be sent to the toxicologist for further evaluation and further treatment. Cadmium is another heavy metal that is used in rechargeable batteries. It is also used as a pigment in paint or used in plastics. Cadmium enters the food chain through soil absorption of leaking sewage. It is found in shellfish, organ meats, wheat, celery, potatoes and other roots. Cadmium overexposure can be harmful to the reproductive system. So coming to the recommendations, what are the recommendations? People who are living near the mining areas, the smelting areas or the industrial areas are high risk to increased exposure to cadmium. Second, one must consider consuming more of organic produce of fruits, vegetables and other cereals. Couple who are trying to conceive or a woman who is pregnant should avoid consumption of organ meat. So to conclude, these were the elaborate lists of environmental toxins, environmental chemicals that we are surrounded with. We are closely connected to our environment. Some things are not in our control and we cannot completely erase our exposure to these chemicals, to these EDCs, to these toxins. However, if we have the right knowledge, we can take the informed decision. I hope you have understood about all the precautions that you have to take regarding your food, water, cosmetics, avoiding plastics, your environment, what precautions you are supposed to take. I hope this information helps you immensely. If you think this is going to benefit some of your near and dear ones, do not hesitate to share with them. I shall see you soon in my next video. Till then, stay healthy, stay hopeful and be smiling.